All right, can we get started? So I have a statement to read before our Zoom meeting. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, June 16th, 2020, on the Zoom platform and in accordance with the town's policy directive and guidelines issued on April 1st, 2020 as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in the committee dialogue. The meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We will start with an attendance roll call. I will announce your name. Please reply. For members of the public, please unmute yourself when I've opened the meeting to public comment. So I will open the meeting. Jill Block, are you present?
Yes, I am present.
Okay, Mark Haddad.
Present.
Alma Healy.
Present.
Ray Considine, are you here?
Present.
All right. Wow, I barely recognized you. Holy cow.
Oh, big difference.
Yeah.
Whoa, look at that COVID beard.
Good.
Wow.
I like it, Ray. Nice.
I like it too.
Handsome.
All right, so we are all here and present. We've opened the meeting for the Board of Health this June 16th. And I think we'll start with agenda item number 2 to discuss COVID-19. What else would we be discussing right now, right?
Right.
Right. So Susan, do you want to give us an update?
Sure. So as of June 8th, we went into phase 2 with the reopening. We're reopening restaurants for outdoor seating. I think we've gotten applications from 4 or 5 in town. So we've approved the 99 Woods Hill table. Paparazzi is in the middle of being approved. Trails End is in the middle of being approved. I'm trying to think who else. And I hear from I think Governor Baker said today or yesterday that the rest of phase 2, which allows indoor dining, might start as early as 2 weeks from now. The tables have to be spaced 6 feet apart. You know, and as you all know, the rest of Massachusetts is reopening, retail's reopening. Every business that reopens has to have a COVID safety plan. For many businesses, the Department of Labor Standards has issued industry-specific guidance that they have to follow to create their COVID safety plan. Gabrielle and I have been working with the camps and the pools. So the pools all have to have COVID safety plans and spacing. The beaches have to have spacing. The camps have very restrictive guidelines. Almost all of the camps in Concord are not going to operate that would normally be operating. The town recreation department is going to operate. Greg Carter's hockey camp's going to operate. Maybe 1 or 2 other little 1-week pop-up sports camps, but it's pretty restrictive. So, so that's kind of that. I will note that our total case count in Concord has stayed at 170, and at the moment we only have 2 active cases, which is great. And as of yesterday, statewide, there were only 59 new confirmed cases yesterday versus the 3rd week of April when we were running between 2,500 and 3,000 new cases diagnosed every day. So that says a lot.
Yeah. Well, I think, you know, just in terms of at the hospital, we, you know, never really hit sort of full surge capacity. And so that was kind of a relief. Okay, and then how about protecting people at town meeting?
So as far as I know, we've adjourned town meeting till sometime in at least July or August, and it may be adjourned until September. I think they keep rethinking that. They are allowing high school graduation, which you probably know, Deb, socially distanced in July.
Yeah, that's, I'm really glad they managed to do something like that, so
Yeah,
it's,
with parent, yeah. I mean, originally it wasn't gonna have any parents. That was so sad.
yeah. I know. Well, we just picked up her diploma by car on Monday, and it's really, so that's not that great. So I'm glad that we can do something where they walk across a stage.
Yeah, yeah.
If I interject, Jane here.
Jane.
As of late, or as of last week, the town moderator officially delayed town meeting to July 29th.
Oh,
And, you know, the regulation is such that you can only delay town meeting for 30 days at a time. So that's not necessarily a final decision or a final date, but it's where we are now.
Sorry, Jane, I didn't hear what the delay was till.
As of right now, it's July 29th.
Okay.
But that's, I don't want to be mistaken as saying that that's the last date. That's just where it is now.
Okay, so if it is going to be July 29th, do we need to be concerned about having, you know, people at the high school, or will this be some kind of virtual event? Or I guess I just worry that our next meeting is, you know, mid-July, and then we may only have like 10 days to talk about, you know, a big group of people congregating for town meeting.
I think it would be highly unlikely that we will settle on July 29th. That's just the 30-day window that the town moderator could delay within. So I think it's just as likely that we're going to hear another 30-day delay when we approach that date. And I'm sure that she would be operating differently if that wasn't the anticipation.
And Carmen had gotten in touch with me with a whole number of questions about remember the memo with the 4 options that you all reviewed at your last meeting? So she had gotten in touch with me with a number of questions about my thoughts on all of those options, and I responded to her, and I can send you that email. But you know, if it's sometime in August, we're theoretically going to be in phase 4 of the reopening at that point, and large venues will be open. So, you know, at that point, possibly we could do it in the high school gym, or maybe spread people out over a number of classrooms or a couple of schools to keep it sort of socially distanced.
Okay, I mean, I guess we can just see what the select board wants and town moderator want to do. I just don't want to be, you know, have a week to scramble with plans or decisions, knowing that we may be scattered, a little more scattered in the summer.
Right.
And Susan, we can work together. I mean, certainly the last thing any of us want to do is keep the public health department or the board, keep you guys flat-footed. So that's not the goal. It's just we are where we are. We are where we are.
Yeah. Okay.
I heard that the town of Maynard did a drive-in town meeting this past Saturday. I don't know how it went, but I think one of my big concerns, not necessarily health, but how do you get the senior citizens who would normally take the, shared vans or places like that, and how that worked out. That's what I'm kind of most curious about.
Yeah, I would be interested in seeing what other towns are doing. It's, I'm not sure what the options are for getting masses of people together.
Well, I thought Carlisle was going forward.
a lot of them are.
Yeah.
And I have a friend who lives in Acton, and I think their town meeting is either this week or next week.
Right.
Mhm.
Mhm. Yeah.
Sudbury, I think, too.
Okay. Wow. All right. We'll see what happens. Susan, do you want to talk a little bit about the Board of Health potentially appointing police officers as health agents?
We did do that.
I'm not sure where this came out of, and so you might have to give me a little bit of background on this.
So at your last meeting, I think you actually voted to do that. The town manager and Police Chief O'Connor had suggested it, and you voted to do it. And then the town manager appointed police officers to act as agents of the Board of Health. And what they've been doing is really sort of policing the public spaces on our behalf. And policing is probably not the right word. Their word for it is educating and encouraging people to behave well. So I think I forwarded you many of the comments and anger we got about the mask rules on the trails and on the Bruce Freeman. And so they've been kind of riding their bikes on the Bruce Freeman and going to White Pond and encouraging people to do the right thing. So they're doing that on our behalf, and I think that's great.
Are you still hearing complaints about the regulations?
That seems to have tapered off. It seemed it was sort of a 2 or 3 week burst after you enacted the local order, and I think people have kind of figured it out now, that it isn't really worth being that upset about.
Right.
Yeah, you know, it's interesting. My colleague who's on Needham's Board of Health, and you know, whose regulations we sort of copied, they didn't get any sort of a peep of a complaint. So kind of interesting.
Wow.
Or no.
And the only other thing I would say is that I'm sitting on the committee that's talking about how we reopen the schools in the fall on their health and safety working group. And we had a Zoom call with all the childcare facilities now that the guidance for childcare is out, to sort of talk with them about how they come up with their COVID safety plans and how that all will work. And as far as I know, Concord Children's Center and I think Milldam Nursery School are going to reopen on the 29th. Everybody else is waiting till the fall.
I just heard on the news earlier that they modified those specific regulations a little bit today, because they were pretty challenging for a lot of people to operate under.
Yes, that's the second time they've modified them
Mm-hmm.
since they issued them. So I will tell you, I think most of the health directors are having some frustration with this. Every piece of guidance that comes out says, you must do this unless you can't.
Right.
You know, you must wear a mask unless you can. You must stay 6 feet apart unless you can't. Makes it challenging to think about how you enforce it, but we'll just do the best we can.
Yeah, that's all we can do. All right. Anything else to discuss about the police officers as health agents?
No, it's going smoothly. I'm not really hearing any feedback from the police at all.
Okay. All right. Well, can we move on to agenda item 3, the board calendar and minutes? I see the dates on the calendar. If anyone has conflicts with those, I guess if we're meeting Zoom, it's much easier than if people are away.
Mhm.
And then since I wasn't at the May 8th meeting, I will defer to those who were there regarding the meeting minutes. Mark, did you have any edits for
Only little ones. Thank you very
I
much.
sent Karen some little ones. But
And I incorporated them, but I just got them, so I just did them.
All right. Anyone else with comments about the minutes?
They seem great to me, apart from
It seems
Mark's.
great to everybody but Mark. No, I'm only kidding.
Can I have a motion to approve the minutes as written?
I move that we approve the May 8th minutes as written.
Do I have a second?
I second that.
All right. And we're going to take a vote individually. Bill, how do you vote?
Approved.
Mark?
I approve.
Alma?
Approved.
Ray?
Approve.
To Green.
Did we lose
Oh,
Ray?
you weren't there.
No, approve.
Okay, all right.
Okay.
So the minutes for the meeting of Friday, May 8th are approved. And it sounds like we will go forward with those calendar dates unless someone has a conflict otherwise. All right, moving on, board member reports. I will start by saying that I was approached by a resident of Concord and another and various people at Emerson Hospital about getting some serology testing in Concord. And the resident's name is Eric Schnadig. And he was sort of interested in getting a percentage of Concord's population tested as sort of like a little pilot study to see where our immunity fell, and thought that it would be interesting. I think he was talking to friends and family members who were all sort of wondering if they'd had it or not, because maybe they weren't sick enough to get tested for the virus. So that has evolved over the past month or so, and we do have a call in with you, Susan, I think tomorrow. But
Yep.
what we had thought about was sort of trying to get testing done, serology testing done kind of once at the high school, sort of trying to get a sort of one-day testing of, say, 500, 1,000 random residents of Concord, and see where our immunity lies. And what's kind of been, it's moved into now is working with the Harvard School of Public Health, either to try and become part of a study, a sort of more longitudinal study, or getting more serial testing done in our community. Because I think really serology testing is what's really going to tell us how we're doing as a community. So probably our immunity rate right now is about 4%, but it may, we may see more and more people have this, especially as we go into the fall and winter months. And so there's a gentleman, a physician at Harvard School of Public Health, who's going to be running who's run sort of a pilot test, I think in Chelsea or Somerville, just to kind of see how it goes. But anyway, I mentioned this to you just so that you're aware. There's we have support from Emerson Hospital administration, and we did kind of run it by Susan and Stephen Crane about a month ago, and had sort of some tentative support, but just to let you guys know, it's sort of a work in progress. I think it could be really interesting. It would be, I think, really neat if our town could get something like this going and sort of be a model for other towns in the state and across the nation for, getting this up, getting it running. Just to let there's different kinds of serology testing kits available. And what we are kind of interested in now is a testing kit that is mailed to a person's home. That's like a little finger prick blood test, and then it gets mailed back. So, would be very, very easy to get people to do, I think. So it's kind of a work in progress. I'll obviously have more information at the next meeting, but I think it could be really interesting. So that's that.
Deb, how widespread do you think this will be?
According to, so the person that we had a meeting with yesterday was Mike Mina from the Harvard School of Public Health, who focuses on serology testing, and he has obviously run this sort of a pilot test, but you know, we were sort of talking about 500 people or more, or sort of a small percentage of people in Concord, but a random sample, so that it would be felt to be accurate. And then, you know, kind of test those people over and over to see, you know, what our immunity rate is ramping up to be. And the thought is, you know, it's at some point the town will have, you know, sort of 40 or 50% immunity, and then we know we're on the down curve.
That's cool.
Part of that number was sort of dependent on cost. Eric Schnadig really feels that he's capable of significant fundraising efforts. And so if it's, you know, $25 a test or $50 a test, that would sort of kind of limit us in terms of how many people we could test. But then we're sort of hearing more options probably next week about, you know, would this be something that Eric would, you know, work on fundraising, you know, getting a community group open, you know, getting a group of people to fundraise it, or could we, you know, get in on this study somehow and then, you know, be a part of that. So I don't know sort of final numbers or how we would do it, but you know, it's something that's really early in the works, but we're thinking about. So.
Yeah, but is he looking for Board of Health endorsement? Is that part of what he's looking for?
No, not really. I think, you know, I got involved just because I'm at the hospital and, you know, sort of have links to the town leadership. If we were part of the study, you know, it's not like we would need IRB approval. They already have that kind of thing. So it's, you know, we might consider getting a blessing from the Board of Health. I think it can only benefit public health. It's information that's helpful. We're not looking for money from the town or the hospital. So, you know, I think this would potentially be free information that would benefit public health, and data we could use. So. Okay, so I'll let you know how that could be interesting, or maybe it'll fizzle out. I don't know. So Susan, the next thing was the emails I think that you circulated around about work on Prescott Road.
Yeah, so I think Jane,
I think
forwarded
you guys probably all saw the emails.
from Mark. I think Jane forwarded you an email from Mark Galis.
Yes.
Mm-hmm.
He's a resident. The town is repaving the road and maybe upgrading the water main. He's not happy that the project is going to start at 7:30 in the morning and go till 3:30 in the afternoon. And then, so I just an hour or so ago emailed you a email correspondence Mark Galis had with Alan Cathcart at Public Works, just so you'd be aware of how Public Works has responded to his complaints or concerns.
I mean, I thought the response from Alan Cathcart was appropriate. I understand certainly noise from construction and you know the interest in starting a little bit later. I think, in general, construction in the summer does start earlier just because it's cooler then and ends earlier. I'm very, very reluctant to really weigh in on this. I understand and I sympathize. Certainly I have construction around our house as well, but I think this is, I think this just opens us up for a lot of other things. Everyone could ask the Board of Health to weigh in on construction projects on their street, or, landscaping noise, or this noise or that noise. So I'm at first pass, I'm reluctant to weigh in and modify or direct, at least from a public health perspective, hours of construction. But I'd be interested to hear what other board members would think about the concerns.
How long is the duration of this particular portion of the construction?
I think it's going to be a number of weeks. I think they're redoing the water mains and repaving them. So ripping the road up, putting in new water mains, and then having to repave the road. It's going to be a big project in front of the houses that are on the street.
Mm-hmm.
I think it's going to go on for a number of weeks. But, it's part of a planned, I think Alan Cathcart said they have 100 miles of road and 130 miles of water main due to be upgraded. And so it's part of a planned thing that was planned, probably last summer and contracted out over the winter before everything with COVID happened. So the contracts are issued, the work is ready to begin,
Yeah, I mean, I would say, I understand there's concerns about dust and exhaust during the midst of a pandemic. I think, we're probably in a lull right now from the viral activity. So I'd say this is probably a good time to start it. I hear it. There's noise and it's disturbing, especially when people are trying to work at home, but I'm very reluctant to mandate a change in the time for the public works to start and stop.
Right.
I would agree. It's a slippery slope if we start getting involved with these other departments' decisions. So it's something we have to be very concerned about. I also recognize the challenges from both the homeowner's perspective, the resident, and having that work outside. But I thought Alan did a good job of laying out just the kind of the domino effect of once you start canceling this work. I think you're right. The summer conditions, summer construction tends to be earlier. And I think you start delaying the progress, and then you get into other weather conditions that make this kind of work, more challenging. You lose the hours of daylight. Some stuff, you delay it far enough and you can't necessarily lay pipes down. So, there's some challenges in really getting it done. But it's really that slippery slope concern of it's not, he has his department to run and Susan has this, and there's different boards governing these things. So.
Great.
I would agree, Jill. I don't think we need to second guess Alan and the DPW's response. I'm curious going forward, though. Is the health department involved in any way in large capital projects in terms of, say, mitigating health impact on the community? Is that something that, Susan, that you're involved in?
Not unless there's some specific public health concern, no. I mean, if someone were demolishing a house, there are dust and noise regulations that we would enforce, or the building department would enforce them to water it down so that the dust isn't traveling. And it would be reasonable to, I suppose, ask the town to have a water truck on site if it's going to generate a lot of dust. I mean, a home demolition obviously does. I mean, I'm trying to think when else, we'd be, if a building had asbestos, we'd be involved in making sure the asbestos or the lead paint was removed properly. But other than that, no, we don't usually get involved in construction projects. I mean, there are state air pollution regulations that speak to it, but most of that regulation speaks to large industrial sources rather than construction activity.
Okay.
So I'll just say I agree with Dr. Green's assessment, but it looks like Mr. Galis, the resident, is on the call. So, if he wanted the opportunity to say something, this is probably the right time to give him a chance to say something.
Yeah, thank you. Yeah.
Okay, hello, can you hear me?
Yes.
Yeah, hi, thank you very much. Thank you very much for considering this. I want to correct a few errors. The project is in 2 phases. One is replacing the water main and maybe putting some temporary paving down, and the other one is a separate project of tearing up and redoing the entire road surface in this area with, I think, 50 homes, something on that order. And the funding for the road repaving has not been presented or approved by town meeting yet, but the funding for the water main replacement, first stage, was approved at the last town meeting. The actual request for proposal for contracting was only sent out I think 3 or 4 weeks ago after the COVID situation. And I was disappointed, and I also said in one of my notes to Alan Cathcart, I was disappointed that he didn't seem to take into account any impact at that time of consulting with neighbors, consulting with people if this was a good time to change the water supply in the neighborhood, and people were still sheltering at home, et cetera. And being over 65, we're trying to be very cautious. Separate issue, we're seeing that a lot of people seem to be taking the opening up as a sign that the risk is completely gone, which is completely false. So anyway, in this particular regard, we're not asking that the Board of Health require anything, but maybe just sympathetically kind of weigh in with the department that, if it's possible by shifting the start and stop, it would be appreciated by residents. It has a health impact. We're not asking for a kind of, authoritarian, I don't know what the right word is, decision by the board, but just kind of a nudge that the town department should be taking into account the actual health of people, including stress, including these unique circumstances. They have an opportunity to adjust things going on. I'm sure that contractors also want to appear to be good public, good citizens. And, if the board, either as a board or if people individually would just kind of indicate to Director Cathcart that, they should really pay special attention in this time to the impact on people. I think we mentioned in some of our letters that people have actually been traumatized in this neighborhood ourselves, and we've talked to other people with, over the past couple of years, some very big tear down rebuilding projects, 2 of which involved multiple weeks of rock drilling. And it was very, very disturbing. So people are traumatized.
Yeah,
my wife wants to say something.
Yeah, this is Tanya Galis. Thank you. I wanted to mention that there was, Ms. Rask mentioned Mr. Cathcart's response, but I don't know if you also received our response back, in which we articulated these recent construction experience here, and again, we are not, especially if it's an urgent project, which I think some people may think it is, and so we're not in a position to decide that. We probably cannot request that it just be postponed to next year or anything, even though the paving part is not clear yet whether it will be funded or not and when. But I don't think that, first of all, and they're not asking to start at 7:30, as Ms. Rask mentioned. They are wanting to start at 7 a.m. Usually that means trucks come at 6:30 a.m. It is just very stressful not to have to go to sleep and feel like, oh, we have to be up at that time with all this noise and Mr. Cathcart's objection in his letter to that time shift request was that, oh, we have to give them enough time to work, and we are not saying they should shorten their time. We're just asking that the start time be shifted to a little later. So just wanted to clarify those points, because we did write something back in response to Mr. Cathcart's comments. Thank you.
Thanks.
I will say I have not been privy to those emails other than what I received today, so I certainly don't have the whole chain of emails, so I probably only have a partial understanding of the situation.
But you
Yeah.
were copied, but okay.
Yeah, some of
We
the,
sent Dr. Green the whole set today.
yeah, the actual timing was of the first stage and the second stage may not have been in those emails, but that is the fact that it's a two-stage, or is it?
Yeah,
Okay, maybe it's in the
everything was.
original one.
Everything
And we
was.
can send them again if needed.
Mhm. Well, thank you very much for your comments. I don't think there's been really anything else that's in history that's really affected sort of everything the way that we do, like the COVID-19 pandemic. It's really making us rethink how we do every single thing in our lives, whether it's grocery shopping or construction or schools or businesses or religion, and so. Thank you for bringing your comments. I would not have considered, street construction and water main replacement as, something that the Board of Health would normally weigh in on. But I hear you. I mean, these are very difficult times. These are, very anxious times. I think we all want things to return to normal and be able to walk outside. And have nice and peace and quiet. So I do hear your concerns. I don't think the Board of Health will, require a later start time at this moment, but we can certainly keep an eye on projects and make sure that they're following public health guidelines and so forth. So but I do thank you for bringing your concerns to our attention.
Well, we are very grateful that you did consider it, but is there any way you could maybe request that Mr. Cathcart consider a slightly later start time? Or at least make sure no trucks show up before 7, because, or 7:30. I mean, like,
well, I do understand the early start time. What I think about, and maybe it's just because I have sort of a physician's hat on, but the summer can get quite hot. And I think one of the reasons for people to start earlier is just that it's cooler in the morning to get work done. Generally there is a little bit less dust. The ground is moist and stuff. And so I do get concerned about workers out there in 100-degree heat. I sympathize with them. And so I think, it's also a matter of considering the health of the construction workers who are out there in the sun, for 8 hours at a time. If they can work a little bit earlier and a little bit in a little bit cooler weather, then, I think that's probably why they start early. I would imagine. So I think, we also have to consider everyone in this scenario going forward. So, but I thank you for your comments. I think we will move forward with our agenda at the moment.
Thank you.
Pleasure. All right. Does any other board member have reports to give?
I'm just going to give a plug for the Services of Open Table, which has continued to operate distributing food twice a week to anybody that can get to us. And we have had a tremendous growth in demand for food at our Maynard location. Anybody can drive up. It's a contactless distribution, and we have the capacity for a few more families. So if anybody knows of families in households in need of food, they can go to the website to get more information. But you know, we just want to make sure that people aren't going hungry when we do have the ability to provide more.
Nice to hear.
That's great. One thing we may want to do is reach out to Lori Hunter, because I know that the high school is continuing to distribute food throughout the summer. They're having a food drive June 22nd, I believe.
Mm-hmm.
But if there's room for a few more families at Open Table, we may want to link Lori Hunter in. She may be aware of people in need. And I can send her an email if that's okay, Jill.
Yeah, that'd be great. Just let her know that she can refer people if she's aware, or if I don't know if they're doing it through their, you know, their food service department, but if they want contact information on how they can really coordinate and we can do something bigger, that I can get the right people's name to her.
Okay, I'll CC you on the email then.
That'd be awesome. Thank you.
Great. Oh, that's great. Yeah, it's really scary with people out of work and in this time. So that's wonderful.
Yeah. Now, if I give you the numbers on food insecurity, it'll blow you away. So that's where I've been spending my time these days, but it's crazy. It's
So is it mainly for Maynard and Concord, or whosoever?
So we have a 23-town service area. The 4 top towns are Maynard, Concord, Sudbury, and Acton, but people from as far as Lowell and Framingham can come. And right now, registered guests come at an appointment time, even though it's a drive-through, but unregistered guests we request that they come after 4. It's specified on the website, but anybody can come. We've kind of had to drop some of our registration requirements just because it was more important to get food out than to get data. Now we want to do some data collecting because we need that too, but no, anybody can come. And, you know, people of all ages. So, and if people can't come, we do have ways of delivering. We've been delivering through the Concord, Maynard, and Acton Councils on Aging, but we also are working with the Neighbor Brigade to do home deliveries in cases of need. So there's lots of possibilities. If people have neighbors and friends, family who can't get to us but need food, there's ways. So they should just reach out to the information on the website.
Okay, great.
Right.
All right. Anyone else, or should we move on to staff reports?
This is Jane. Can I offer a quick update?
Sure.
I just wanted to remind everybody that the town will be opening White Pond Beach for swimming for memberships on this weekend. And so therefore, obviously the Board of Health, along with others, careful regulation of algae blooms, et cetera, are going to be important for those, especially because we have a reserve in advance program going forward to be careful of the evolving regulations on public swimming areas. I know that the rec department and senior staff spent most of the day doing things like floating out the buoys and constructing sort of 10-foot, special box, visible delineations of seating areas to allow those who use the beach to be socially distant. But one, it's a great resource. It's exciting that we're going to be opening it. 2, I hope everybody follows the regulations that are going to be posted on the town's website carefully and thinks about reserving in advance. And that, we are able to keep on top of algae blooms and anything else that may come up, that the Board of Health will obviously be in a unique position to regulate on. So, public service announcement.
It's great. Yeah. Hopefully this year, no algae.
Oh, wouldn't that be nice? We could all use that break.
We could, yeah. All right. Staff reports, Susan?
So really, the only other thing I have to report on is here we are heading into Triple E and West Nile virus again.
Fun.
Just what we need.
No.
So I sent you the link to the 2020 arbovirus surveillance plan, which is, pretty standard every year, but it has the sort of risk and response matrix that we can all refer to if we start to run into problems. And then the State Department of Public Health and Department of Agricultural Resources did a little webinar a week ago or a few days ago, and I sent you the slides from that. And the relevant stuff kind of starts on page 10. So some kind of key points are the surveillance and trapping. They're going to add trapping locations and expand surveillance efforts. And they're working with the mosquito control programs to reduce time between trapping and test results. So we'll get the results quicker when we start having positive mosquitoes. They're going to try to do, like usually they do larvicide in catch basins for the mosquitoes that transmit West Nile virus. The larval mosquitoes that transmit Triple E live in the red cedar swamps, the white cedar swamps and the red maple swamps, and they typically have not larvicided there, but I think they're going to try some larviciding in those locations this year if it starts to look bad. They're sort of reviewing the adult pesticides that they used last year to see whether that's the most appropriate thing to use if we have to do aerial or backpack spraying again. They're going to roll out a lot more public messaging, which will help local boards of health because we won't have to come up with it ourselves in a hurry. And that's going to be good. You'll kind of see that stuff on page 12 and 13 and 14 and 15. You might remember from last year, you could go on the state map that showed the risk by town. I think that they're going to have a new Triple E risk map that's going to be more interactive and more live. So that's going to be good. And then another thing they're going to do that they discuss on page 16 is, remember how last year we canceled all the sporting events and everything outdoors at dusk? And they're really realizing now that the real period of transmissivity or high risk, lots of infected mosquitoes is really only about mid-August to mid-September. So maybe after September 30th, we could start letting late afternoon sports resume. Instead of, this year we didn't get a killing frost till November. And so that was kind of the end of sports for kids after school. So they're going to try to work with that so that if we have to shut down, sports practices late summer, early fall, perhaps they can be resumed later on.
Do we want to give like the athletic directors in the various schools sort of a heads up that they may want to be planning to not have Friday night football games until, October or something? Is that a reasonable thing to just warn them about? Or do you think they're already planning?
I don't think they even know what youth sports are going to look like in the fall yet.
Yeah, I think that's the bigger issue they're dealing with right now. That's the issue they're dealing with. If they're going to have any, never mind.
That's true.
But, I think that I'm glad the DPH is doing additional, or whoever it is doing more public education. But I think given that people are doing more and more socializing outdoors because indoors is riskier, that there should be some enhanced messaging around that in terms of kind of the times of day that you really don't want to be outside. So, because I know every social engagement I've had has been outdoors lately.
Yeah.
That's great.
Yeah, and Susan, maybe this wasn't on purpose, but you sent that Triple E material and the restaurant material together. And of course, the first thing I thought of was all this outdoor eating right at the peak times. So I don't know if maybe the restaurants, to be specific to them when you're letting them do outdoor seating, to be careful.
Yeah, a good point.
That's a great point.
That's a very good point.
So, Susan, I have a question. Does DPH do traps and surveillance in towns that don't participate in the mosquito control program?
No,
Or do they test everywhere?
they don't test everywhere. Let's see, if you look on page 19 of those slides, it says challenges non-member towns and
Right.
additional 25 towns identified for treatment. However, as the towns have not joined a mosquito control district, Mass General Law, Chapter 252 restricts the Commonwealth's ability to treat those communities. Once you get out past Worcester, a lot of those towns just are not in a mosquito control district. I think I said this once last fall or winter when we had the big meeting with DPH. We spent $20,000 to be part of East Middlesex Mosquito Control District. We are getting such a bargain because the towns outside of Worcester they're asked to pay like $60,000. These little tiny towns,
Wow.
and they can't afford to do it.
Yeah.
I guess I was struck because I didn't think Carlisle participated last year.
They don't.
So we have a neighboring town where, we're sort of kind of flying blind here to a certain extent because we don't know, what the mosquito control, the situation is in a neighboring town like Carlisle.
Or Lincoln, for that matter. Did they last year?
Lincoln's part of East Middlesex.
Oh, okay.
So,
Yep.
so I think there's sort of inherent weakness in the program where towns are not required to participate. So other towns are, really don't have all the useful information that they might need.
Yeah.
And
Sorry.
so I know I've mentioned this before, Susan, but a lot of the youth sports is in the Carlisle fields. They're
Right.
Concord Carlisle programs, and so that raises the relevance to Concord specifically.
Absolutely. I'll note that, and we'll try to address that if we start to run into a bad situation this summer.
Susan, this is Jane. Just on the restaurants, eating outdoors note, I know that the town manager and some of the staff are working on a rules and regulation, or sort of a consolidated license for outdoor dining.
Yep.
And having some input on that right now would be, a lot easier for everybody than piecemealing it later.
Yep. Good point. Good
So
point.
one simple thing I'll mention, Susan, is, in Maine, when you go wait outside online to get into the overcrowded lobster place, they have free insect repellent. And so, like, to me, an obvious thing the restaurant could do is just have that available for their customers when they arrive if they don't have some.
That's a great idea.
Yeah, it's a really good idea. Yeah.
Yep.
Susan, I remember last fall there was, wasn't there reporting issues where there was a child in Sudbury who was infected and sick, and it was really difficult to find out that information, even though it was all that you knew was county, not specific,
Right.
that neighboring community. Has DPH changed anything with reporting on that, as far as you know?
Well, I think they're going to try to do a better job. They heard from a lot of towns that abutted. I think we had 12 human cases last summer, so there were a lot of abutting towns to the towns that had the cases. And being the last person to find out is never a great thing, especially because the press find out and then your phone is ringing. So
Right.
DPH heard that, and I think they're going to try to do a better job doing outreach to the towns that are next door to the affected towns. I think last summer they just were overwhelmed with the number of cases, and they were just scrambling themselves, and that's why they've put a lot of time over the winter into thinking about how to do it better this year. And then, of course, COVID came along. So, Katie Brown, who's she was the state veterinarian, and she's sort of their zoonotic disease person. But now, when Al DiMaria retired, she became their head epidemiologist. So she's now a little busy with COVID.
Mm-hmm.
Although she's still trying to focus on Triple E and West Nile, because that was kind of always traditionally her area.
Mm-hmm.
Mm-hmm.
So, but they've put a lot of thought into it, and I hope that they're going to do better outreach to the affected towns. The other thing they're going to try to do is, remember last year when every town around us was at high risk and we were still at medium risk? even though we knew we had positive mosquitoes in every other town. And they're going to try to work harder with the towns to sort of adjust the risk levels based on that kind of stuff, and to explain why someone is medium versus another town is high, so that it's clearer for public perception what that's all about and what the real risk is.
Mhm.
So that'll be good.
Yeah, that will be good.
Mhm.
Okay. Anything else?
I think that's it.
Okay.
Jane, what about the email, the chamber email? Susan, what about
this-
that email,
Oh, yeah,
the chamber,
Sorry.
chamber partnership or something?
Right, the Kate Carr's email inviting the board to, I guess, have a joint meeting with the Concord Business Partnership in July.
Okay.
Did everybody get that? I sent it
Right.
on.
I think I got it. Yeah, I can probably go to that. Is it a Zoom or an in-person meeting? I can't remember.
I believe it's an in-person under the tent at Barrel Farm.
Yeah, I think I can go to that. So unless another Board of Health member is dying to get out of the house and go.
I think they invited all of us.
Oh, well.
No, hello. Hi, this is Greg Higgins. I happen to be president of the business partnership, and I was listening this evening. I didn't know this was going to come up. I was listening in the hopes that somebody was coming to a meeting. I wanted to hear your issues. And no, it's just to have, we tend to have boards come to us, planning and DPW, and we haven't had the Board of Health come, and I've been on for 10 or 12 years. And the board, we just felt that it's an appropriate time to have somebody come from the Board of Health and discuss it with the partnership, and maybe Susan. You know, no, it was not intended. Any one of you is welcomed, but it wasn't intended to be a public meeting in that sense where you'd have to post and all that.
Okay.
Just to be clear, I didn't mean to speak this evening, but I didn't want to get off base. It was just a friendly meeting to find out what you guys are facing, and there are store owners and landlords and folks like me that don't have either of those issues, but that, you know, just to discuss it, that's all, over a scone and a cup of coffee.
Wow. That sounds good. All right, I will double check the date, but I should be able to attend. So happy to do that. Okay, anything else?
Just remember that your terms are extended until Jill and Alma got an extension on their terms, because town meeting was not held, and Dr. Green is going to continue to be chair until town meeting is held, and everything's just going to go on the same.
And we feel very lucky for that.
So do, yes, we do.
Yes, we do. Yes, we do.
We say it all the time, trust me.
Thank you. We're stuck.
Yeah. All right, well, if there's nothing else, do I have a move to adjourn the meeting?
So moved.
Need a movement to adjourn the meeting? Second?
Seconded.
Second.
All right.
You have to do a roll call.
Oh my goodness, okay. Jill, how do you vote to adjourn the meeting?
I vote to adjourn.
Ray?
I vote to adjourn.
Alma?
I vote to adjourn.
Mark?
I vote to adjourn.
All right, all in favor of adjourning, I will say good night to you all. It's good to see you.
Thank you.
Thank you,
Bye.
everybody.
Bye-bye, everybody.
Thank you.